The NHS is under as much pressure now as it was at the peak of the pandemic in January. Well, let's talk now to Patricia Marquis, who's Regional Director of the Royal College of Nursing. Thank you very much for joining us, Patricia. And what pressures have members been telling you that they are under?
Well, much like NHS providers are saying, the pressure is immense within the NHS at the moment. It's a combination of things. It is really unprecedented calls for urgent and emergency care. So our emergency departments are really very, very busy with a combination of things, which does include COVID. Hospitals also and other health settings are having to continue to take social distancing measures seriously. So capacity is actually more limited, physical capacity, than it would normally be. But we're also talking about trying to climb back to or complete all the planned surgery, cancer treatment, mental health services, community services, primary care visits, all of those things that didn't happen as effectively as we would have liked them to have done over the COVID period. So it's a combination of things, but our members are telling us that it is incredibly busy and the pressure is really, really immense and is taking a real toll on them.
And Chris Hobson from NHS Providers said to me earlier, pressure is pressure is pressure, no matter where it's coming from, whether it's COVID, non-COVID issues, etc. But as I was just discussing with Nick Triggle, we now have had 6 days with coronavirus case numbers falling. The exact reasons behind those we don't know yet, and we need more data to be clear that the trend is absolutely real. Hopefully it is. But does that give any measure of reassurance to staff, do you think?
It may give some level of hope, but I think it is early days, as others have said, to start thinking that this is over. And the pressure on the NHS will continue. It will be helpful if the COVID rates and the COVID admissions to hospital, particularly in other services, do reduce. That will certainly help, but that will not take away enough pressure to enable the NHS just to continue as it was pre-pandemic. We have got a burnt out workforce who are exhausted mentally and physically. We've got a summer break where people need to take their breaks that they've delayed for, in some cases, 6, 8, 10, 12 months. And we've got to, as I say, gain back the ground that we've lost on all the other services, whilst some of the services are under immense pressure. We've got a vaccination programme, a very complicated vaccination programme to deliver over the next few months as well. And everyone is predicting that this winter will be very difficult.
And briefly, Patricia, and I get a sense of what you're going to say based on your last answer, but given the pressures you're talking about, given the pay review as well, what is morale like? Because we know that staff in the NHS, when we go into hospitals, staff are always remarkably wonderful and cheery. They do put on that brave face in front of patients, don't they? So how is morale underlying all of that?
It is rock bottom, I think, is probably fair to say. Pay has certainly not helped and has contributed to people feeling not as valued by the government as they really should, and as not part of the solution, which is what they see themselves as. We have huge vacancies within nursing, which has increased the pressure over the last months and will continue to mean that nurses go above and beyond for months and years to come. But it is vital that the government really takes this issue of NHS funding very seriously. A starter for 10 would be to fund properly the small pay rise that they have agreed for NHS staff. And beyond that, they absolutely need to fund the NHS at a level that will enable them to deliver the services through the staff and through the workload that they need to deliver over the rest of this year and in the years to come, quite frankly.
Patricia Marquis from the Royal College of Nursing, thank you very much. The trial begins at the Vatican today of a Roman Catholic cardinal who used to be a close ally of Pope Francis. Cardinal Angelo Becciu faces